disgusting how this government continues to pat us on the back and say thank you so much for your work, but we just can't afford to pay you.
The health system is under strain like never before. New South Wales Health must be one of the priorities when we are talking about budget. This cannot continue.
We need to retain nurses and midwives in New South Wales, and we're not going to do that without their pay.
Desperate nurses say that they can't wait for a court to rule on their pay dispute, with many deciding to leave public hospitals. Hundreds have tried to drown out the Premier as he faced an inquiry at State Parliament.
Nurses rocking the house and riding on.
Friday is actually my last shift in ICU in a regional hospital. I'm going to go work in the private sector.
Rallying outside and watching a high voltage hearing inside. The Premier pushed on why police are the nation's best paid, but nurses are left to do dirty deeds dirt cheap.
Where's your big bold offer for nurses, midwives?
We expect this government to sit down and negotiate with the biggest female workforce in this state. These are people who are struggling to put food on the table and pay their mortgages.
I thought Labor was on our side, and it's just really disappointing that they're not coming to the table.
Nurses are actively choosing to leave this state and chase more money. That is not good for patients in our state.
Nurses are having to work so many extra hours in New South Wales to be able to support their families that they're exhausted.
Basic human care has gone out the window. Everything's a rush and people aren't getting the basic care that they really deserve.
It's a moral injury almost every day you go to work. We know what we should do for patients in our heart, and we don't have enough time. So we pick and choose what we can manage, and that often means holding the hand of the dying person goes out the door and you just move on to the next thing.
We have had the walkout of the psychiatrists. We have put pressure on EDs. It's a mess, and our patients are suffering.
The morale is just low. Like, people are openly saying, I'm looking for another job.
We have nurses that are obviously going into state for better pay, they're going into the private sector for better pay. A lot of them are getting to the point where they're leaving altogether.
At this point, I'm honestly tempted to just go to Queensland and take care of my nan, because there's just no pay here.
That actually don't care that we can't pay the rent and that we can't afford to buy a house anymore.
We're on 2008 wages. Nobody can accommodate for that in the current cost of living. And on my particular ward, I've had almost 40 permanent staff members leave in the last 4 years.
It's a hard job, that's why. So we just want fair pay.
We have MPs refusing to meet with nurses and midwives in their own communities, when nurses are going to talk about severe understaffing, closures of mental health services, of maternity services. We are being ignored. That is a gender issue.
How disconnected is this government? I want you to go into your MP's office and I want you to ask them, are you supporting a 15% pay rise?
I'm really over it. With male-dominated professions getting raises and everything. We didn't choose this job for money, but it would be nice to be appreciated.
I think it's absolutely fantastic for our police and our teachers and our ambulance service to get the pay that they deserve. But I think it's absolutely appalling that our nurses have been left behind.
Come spend one day with us and you'd fix it immediately.
A pay rise is too important when our members cannot afford to put food on the table. We will not give up the fight.